they do enough in Michigan.
Governor, I wanted to ask you about the censure of Tom Rice by the state GOP. What are your thoughts on that? Do you think it was warranted?
Well, that's a political organization, and they're making a political statement. And of course, Mr. Rice and any others is voting on things. They should use their judgment, vote their conscience.
Now, Governor, with both the UK and South African variants now being detected in South Carolina, do you think there's an increased urgency to see vaccinations here?
Well, there has been an urgency to get the vaccination from the very beginning, and as you know, we are receiving more vaccination, more doses than we're getting into the arms of people now. Our hospitals have caught up. They started slow. Some of them still moving a little slow. Some of them moving very quickly, like Prisma. Today, our pharmacies are not moving fast enough. They've got to get moving because they're getting much of the vaccine there, but they are way down on the list in the number of doses that they have gotten. These new strains, we don't know much about them. I know the experts believe that the current vaccine will offer some protection, perhaps complete, and perhaps less than that. But right now, what we have to do is people that want to get the shot, go on and get the shot. Make your appointment, or some of the places you can walk in, as they've described here with Prisma. But get the vaccine.
Governor, one more impeachment question. Have you heard from the lawyers that decided to back off the impeachment team, and do you know why that decision was made for them to depart?
I don't know why it was made. There's some speculation, but usually those sorts of things are between the attorneys and the client.
Governor, a vaccine relief funds bill is moving through the State House right now. What are your thoughts on that bill, and how important would that money be for rolling out the vaccine here in South Carolina?
Well, it's important that we have ample funds, and I believe we will have, but the main thing we need to do is to get these locations that are set up and authorized to give the vaccine to do it, and to do it quickly, to let people know that they're open for business for the vaccines. You can find them on the DHEX website and others. We have about 600 pharmacies that are authorized to be a part of the program. So far, it's under 300 of them, I believe, are actually giving the vaccine, but giving the shots. But they just the numbers show they're not giving them fast enough. So we want to be sure that they have what they need, that they understand the program, that they understand the urgency, and we'll do whatever it takes to see that those shots are given at those pharmacies and other places. And we've got to get out into the rural areas as well. So now's the time for all of these entities, the hospitals, the pharmacies, and others in between, the long-term care facilities, the nursing homes, the Walgreens and CVS teams are the ones vaccinating there. But we got to get it done. It's not moving fast enough. It's not as smooth as it needs to be for the people of the state to get their shots.
Governor, would you explain the bottlenecks that are occurring at the pharmacies and why they aren't?
Well, it takes a little while, I suppose, to get all your equipment ready, but there's no reason why they should not be moving, they should not be running out of vaccine just as quickly as they get it. The hospitals, there were some bumps in the road, there were some misunderstandings on what the protocols were. Some felt they didn't have the staffing. We urge them to consider reducing elective surgeries if they didn't have the staffing, and put that on the vaccines, on giving the people the shots, and then we open it up for 70 and above, because in some places there was minimal flow through the hospitals. But those steps that we took, and the encouragement and the coordination that we've had, including that with the National Guard in some of the hospitals giving shots. The hospitals, most of them are moving very well. Prisma is moving very well. Some are not moving as well as we'd like them to. But the pharmacies, there are a lot of pharmacies, there's 600 of them out there that are eligible to receive the vaccine and give shots, and that's where a lot of these shots need to be given, and they are not moving fast enough.
Governor, any plans to move teachers up when it comes to vaccination?
Well, as soon as we can get those, we have 70-year-olds as well as the rest of 1A, And I'd like to move that down as quickly, my intention, as quickly as possible, as soon as possible, to 65 and up, and also go into 1B then, which includes the teachers and a lot of other people. But it is the older people we know that are most at risk. The average age of death from the virus in South Carolina is 75 years old. So it is the older people that are most at risk, and those are the ones that we must see have the early opportunity to get a vaccination.
Do you have a timeline or a threshold for when you might expand access to that 1B crowd?
As soon as we can get those that are coming in for the vaccinations now, and I want to move it down to 65 years old and over soon. And as soon as we can get that flow moving, then we'll move it into the next category. But the key is getting the pharmacies and all of the hospitals vaccinating at maximum speed. And all of them are not doing it at maximum speed today.
All right, last question.
Governor, I just wanted to clarify, you're saying that you want to push out 65 to 69 age group above phase 1B?
That's right.
Okay, and when do you anticipate you might?
I would like to do that as soon as we can. As soon as this flow seems to have steadied and we can accommodate it, then we'll open it up to 65 and above.
But you're very happy with today's announcement, though, huh?
Oh, this is a great announcement. Prisma is a superstar in the work that they've done. There's some other hospitals that have done very, very well as well. Prisma, as you know, has I think 12 different hospitals, maybe more than that. But it's a fine organization, and what Mr. Haller described is contact with the rest of our team is accurate. We've conferred, and they're doing a great job. And those 5 mobile units will be critical. One thing important that you said I want people to understand is that a lot of people calling up and volunteering. We issued the order that allowed retired physicians, retired nurses, and medical students, and some others to get vaccinations, and they can go straight to these hospitals or straight to these other locations. So there's no need to try to create red tape to accommodate that. You can volunteer on the DHEC website, but that's not necessary. And we've seen in a lot of the hospitals that's exactly what's happening. They'll open up a mass vaccination site somewhere near the hospital, and you have volunteers coming from all over the place that are qualified to help. So we want to encourage that, because that's the kind of, it really needs the communities need to be involved in this, as well as the professionals.
Awesome. Thank you. No, we called last question. We're done. Sorry. Thank you, everyone. We're good.
Thank you very much.
Thank you.